Hello and welcome to vlog number 114. This week I'm going to talk about sexual dysfunction in Parkinson's disease. This subject was prompted by a question that someone posted in one of the PD groups on Facebook, and it struck me that in all the time that I've been a member of these groups, it was the first time that I'd seen anybody raise the issue of sexual dysfunction. I also noticed that it was a woman that asked the question, and almost all of the responses were made by female members of the group. I'm guessing that the majority of men were too embarrassed to admit that they too have experienced sexual difficulties or anomalies. Parkinson's can affect your sexual well-being in a number of different ways, from erectile dysfunction, uncomfortable intercourse due to decreased lubrication, the stigma of PD itself, changes in sensation, painful muscular cramping, increased tremor and or dyskinesia, and so on. I found the following statistics quoted in a study titled Sexual Dysfunction in Parkinson's Disease by Bronner et al. Of a group of 75 people with PD, 32 women, 43 men, 87.5% of women reported difficulties with arousal, 75% with reaching orgasm, 46.9% with low sexual desire, and 37.5% with sexual dissatisfaction. 68.4% of men experienced erectile dysfunction. 65.1% reported sexual dissatisfaction. 40.6% premature ejaculation. And 39.5% had difficulties in reaching orgasm. The study does also state that sexual dysfunction prior to the onset of PD may contribute to the cessation of sexual activity during the course of the disease. 23.3% men and 21.9% women. Sexual dysfunction can be as a result of medication, or may be due to the physical effects of PD on such things as depression and mood, coordination and slowness of movement. The physical ability to have sex is controlled by the nervous system, so it makes sense that problems with sexual feeling and function are common in people with Parkinson's and a whole host of other neurological conditions. Sexual dysfunction is also common in people who do not have PD. It becomes more common with age, for example, so it's not always clear whether it's as a result of the condition or not. The motor symptoms of Parkinson's can create barriers to sexual activity. Tremor and dyskinesia intensify with excitement. Certain medications can influence sexual function. Dopamine agonists can cause impulse control disorders such as hypersexuality, whilst other Parkinson's meds, individually or in combination with disease progression and the non-motor symptoms of PD, can result in diminished sex drive, difficulty in reaching orgasm, and, in men, problems in achieving or maintaining an erection. Erectile dysfunction often coexists with depression, and treating the depression can often have a positive effect on erectile dysfunction. The symptoms of depression, their impact on confidence and body image, and some medications used to treat depression can all affect sexual desire and performance. Treatments for erectile dysfunction range from medications, Viagra and the like, through psychological therapy to surgical implants. Sexual problems for female PD patients include discomfort during intercourse due to a lack of lubrication, particularly in postmenopausal women, poor body image, diminished libido and a lack of arousal, and an inability to achieve orgasm. Treatments range from adding lubricant, timing sexual activity for when PD symptoms are under control, and or discussing issues with a qualified therapist. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.